Hello, I am your host, Josh Hawkins. I'm a specialty registrar in public health in the UK, and I'm excited to welcome you all to a special series of episodes in partnership with the Faculty of Public Health to showcase the candidates running in the 2024 Faculty of Public Health elections. We'll be joined by candidates for President and Vice President, and we'll be exploring their vision for the faculty and why members should consider voting for them. Voting is open Thursday 14th of November and closes on Thursday 12th of December. And today we welcome Zafar Iqbal, currently Associate Medical Director of Public Health in the Midlands, having previously held 2 Director of Public Health posts and having been Medical Director of an NHS Trust. Zafar trained as a GP and has also held a number of national policy roles, such as being member of the NHS Health Checks Clinical Expert Committee. He has served the faculty for over a decade in various roles, such as Assistant Registrar, in which role he has led the 4 Nations Public Health Workforce Strategy. He currently chairs the NHS Provider Public Health Network after earlier serving as the Registrar for UKPHR and overseeing the new portfolio route and the related quality assurance processes. Zafar has served on the Global Health Committee for over a decade and sits on the FPH Health Services Committee. He is a visiting professor in 4 institutions, and most importantly, he takes training incredibly seriously and was immensely proud to receive a Trainer of the Year award. He sits on the West Midlands School Board as a training coordinator and is involved in the national recruitment process. He has an ILM level coaching qualification, which he finds invaluable for training. Quite a resume. Zafar, welcome to the podcast.
Thank you.
Thank you for coming on. Now, first question, why do you want to be Vice President of the Faculty of Public Health?
Well, Josh, at the moment we're facing public health crisis on many, many different fronts. The health inequalities are deepening. We have a cost of living crisis, which is going on and on. We have an NHS, which is on the brink, and we're accelerating towards climate change. On top of that, we've got a fragmented public health system. And if that wasn't enough, we should be bracing ourselves for anti-vaccination sentiment surging over from the Atlantic fairly soon. But we've also got an opportunity with the new administration who may well be open to radical public health ideas. And we have an opportunity to engage with Europe as well. And in my experience over the last 30 years or so in public health, you should never waste a crisis. And the opportunities may not come again for some time. It's a really critical time for public health with all these crises there. I've been really fortunate to have served in the board led by Kevin Fenton, who's just set the bar so high. And the progress he's made on a whole number of fronts is just been amazing. But circumstances are changing rapidly, and this is not the time for business as usual. I think we need to be courageous and take risks. And I'm standing for the vice president role because I think I can provide the board with a supportive leadership, provide the new president with a supportive leadership at one of the most critical times in our public health history. And I do have my own radical public health ideas we can explore later on.
Yeah, I'm sure. And as you mentioned, some of the challenge there and some of your ideas. So what will your key priorities be as vice president?
To be honest, I think policy is not our issue. I think we have the solutions for many of the crises that I've described. And, creating the special interest groups was just genius. I mean, they're just amazing. They're powerhouses. And for example, the work by the climate change SIG with Paul Johnson and colleagues has just been amazing. I thought the FPH vision document pre-election was just fantastic. It's so many. The answers are there. The real question for us is how do we get those enacted? For example, I mean, I also chair the NHS Provider Public Health Network, which has about 150 consultants and trainees. And we're working really hard to influence the thinking at the national level for the NHS in terms of prevention. We're working with senior leaders in the NHS to ensure prevention is offered within the NHS. But to be honest, Josh, unless every CEO has to do it, it's not going to happen quickly or uniformly. And I'm also on the faculty's prevention group where we're reissuing the paper we did in 2019 on prevention. So I think the faculty, for example, with the NHS should be arguing that the NHS should become a public health organisation. And that's a prescription for the ills of the NHS. That's a radical idea. So coming back to your question about my priorities, I think the priority is about advocacy. It's about how to generate opportunities for the policies we already have to get those enacted. So that's in terms of policies. In terms of the public health system, I think, yes, of course, public health professionals do an amazing job day in, day out, but that's largely not because of the system we work in. That's because of the system, that is in spite of the system we work in. I want to see a system whereby trainees feel confident, they're excited about their future, and they're maximizing the opportunities that the training program offers. I often find trainees in ST4, 5 too bogged down in the competency work rather than actually making use of the amazing opportunities. It's an amazing training program. And I want trainees to feel training is fair and inclusive. And we want a radical approach to the new curriculum, which needs to obviously include things like climate change, needs to things like AI, risk stratification, those kind of new ideas need to come in. I'd love to see consultants be able to be mobile across different organizations with comparable conditions and pay. I want directors of public health to become super powerful in their areas to influence all the organization assets in their patch. That would be radical, wouldn't it? We do need a diverse workforce, and the Rights in the Summer really highlighted the importance of the faculty's anti-racism framework. But I think the answers also lie with the members, and I think we have to engage members, ensure the grassroots are in, setting their direction of travel for us. So my third priority would be to reach out and listen to ensure the voice of the associates, practitioners, trainees, consultants, directors of public health, civil servants are all heard.
Yeah, but interesting. Thank you. And on that wider membership there, so how will you contribute to ensuring that FPH members are supported across their career paths to meet current and future public health challenges?
Well, when I look back at my own kind of experience and career, I was really fortunate to have fantastic trainers and mentors who gave me confidence, who urged me to think big and aim for the stars. The late Sam Ramaya, who some of you may know, was an amazing mentor, not just to me, to many, many other people. So I've tried to give back something particularly in the training kind of zone, where I played an active role in training for many years. I'm on the West Midlands Deanery. I take part in the national recruitment process as well. And as I said, I was really kind of humbled and also delighted to receive that award I got last year for training. I think the question of training pathways career pathways is actually really important. And when I was leading that work across 4 nations, it really struck me how different the issues are in Scotland, Wales, and Ireland, and kind of England. And the issues trainees are facing are very different to new consultants. And when consultants get in their middle part of their career, it's a different set of issues towards people like me, kind of towards the end of their career as well. I really sort of feel for the pain of many consultants who work in local authorities, who work in organisations who are fighting for financial survival, and it's really tough trying to influence public health in that kind of setting. And I think the faculty needs to obviously work with the ADSPHs and the LGA, but I think the faculty can say things which other organisations can't. And I think we should take that opportunity, about how the system works, etc. And I know there are enormous challenges for those trying to get on the specialist register through the portfolio route. And again, I think the faculty could play a more constructive role. I'd really love to see every member of the faculty, taking a role within the SIGs, who are really powerhouses for the faculty policy work. I'd like the SIGs to have a stronger voice in that policy setting. And finally, I suppose, Josh, just just recently, in the West Midlands, the question was asked about the faculty subscription and value for money, and are we getting value for money from the faculty? And it's really important. We always try to answer that question, and we don't take our members for granted, and we justify our work to the membership.
Really interesting. Thank you very much. And final question, what makes a good public health leader, and how would you describe your leadership brand?
When I was DPH, is a really tough job. I probably used every leadership style in the textbook, and probably a whole range of styles which aren't in any textbooks. But in kind of my experience, when I've been successful, that's been around managing large scale where there's been a clear vision, clear direction of travel. I've been able to take people with me through a high level of participation style, delegation has risks as well, but taking those risks. And one thing that's often helped me is having a crisis, and clearly we've got no shortage of crisis at the moment. So I've done some good work in that kind of area, and we've got a perfect storm at the moment with all the crises that we're getting. But we have got this short-term opportunity to make an impact, and I think the faculty needs to be bold, courageous, take those risks, and be opportunistic at this moment in time, because we may not get this opportunity for a long time. This is not the time for business as usual. And I've also like to say that I've been very fortunate to have not just worked with Kevin Fenton, just magic, but John Middleton, Maggie Ray as well. So we need to build on their legacy as well, and we need to take our membership with us. We need to listen, engage, create a common purpose, create a direction of travel. And I will certainly employ a participational leadership style in supporting the new president and the new board.
Really interesting. Thank you very much, Zafar. It's been a pleasure having you, and I hope you've appreciated the chance to get your message out. Reminder to everyone to vote. Voting information will be emailed. I think it should have already been emailed to all FPH voting members on the 14th of November. Please look out for that email if you've not seen it from FPH at cesvotes.com. Zafar, thank you very much for joining us.
Thank you, Josh.